Hello. Yeah, good morning. Good morning. You're welcome to Close Flow. Increasingly, this is becoming your favorite program on your family channel, NTA2 Lagos. So it's our pleasure welcoming you to the midweek edition of the program. And as always, we're going to be looking at a lot of issues again. We have another interesting guest in the house. We have another distinguished Nigerian, actually. Let me just tell you a little bit about him. He's a specialist urologist. Don't ask me what that is. He would tell us exactly what that means. He's been in medical practice for almost 30 years now. He had his basic medical education here in Nigeria at the famous University of Ibadan. Thereafter, he had further trainings in UK and in Germany. Over the years, because of his experience and his accomplishment, he became Fellow of the West African College of Surgeons, Fellow of the International College of Surgeons, member European Association of Urology, and then also member International Society for Men's Health conditions affecting men particularly. We will go into details. My pleasure welcoming onto the show, Dr. Ogah. You're welcome to the show, sir. Thank you very much.
Good morning.
Good morning, sir. Let's go straight into the thick of business. You were the national president of the Association of General and Private Medical Practitioners in Nigeria for several years.
Yeah, for 4 years precisely.
For 4 years, and up to now, you're still a trustee
Of the association.
of the association. So why has it become so impossible for primary health care to have any impact in the country? Why is that a problem?
Because it has not been on paper, the design has been there to have primary care. It started when they said Health for All the year 2000. They built during the period when Professor Ransom Kuti was Minister of Health. The design was to give all Nigerians primary care by the year 2000, and they built a lot of primary care centers across the country. Those centers have not been properly managed. There aren't adequate staff to manage them. The places don't have the basic infrastructure, and because of that, primary care could not be given to all Nigerians. And of course, many issues, fundamentally infrastructure. Second, the financing, healthcare financing in the country is still at a very low level.
Yeah, but the alarm here, therefore, Doctor, is the association. What did you do while you have when you had these problems? Growing on the government, growing on such a quality decision, a quality policy that all Nigerians must have access to quality health by the year 2000. What did the association do?
Oh, well, even when I was president about 13 years ago, I made a write-up. The association had solid views, good views of how the health care of this country should be managed. And in the position paper, I paid a courtesy call to the then Minister of Health, I think the year 1999, and I presented the paper to him. He looked at it, he read it, he said it was lovely, and thanked us. We left. Most of those recommendations have not been carried out. And thereafter, a lot of presentations have been made to government, which on paper they would agree to, but they wouldn't carry out. And that is why our care delivery is still in this state.
Well, it's disheartening, really, that there is so much disconnect between brilliant thinking, brilliant policy, direction, and then the implementation of those directions. And there's nothing we can do about it. That means we are like between the devil and the deep sea.
No, I think it has to go to governance. I mean, you have to, let's face it, since independence, Nigeria has always had mediocre governance. I mean, that's it. We've had mediocre governance since independence, up to date. Therefore, the quality of governance we had is that the kind of governance that does not have the capacity to deliver on promises. You cannot do what you don't have the capacity to do. Even conviction is a form of capacity. You have to have capacity to be convinced about something, and for that conviction to motivate or galvanize you to take appropriate action. And that's what we don't have.
Now, that will come to this cliche, the Nigerian factor. So, I'm just, you're a medical practitioner. Yeah. So, can we find a medical reason for what we now call, jokingly, as it were, the Nigerian factor? Is there a medical reason? Is it a Malay that we find in the Nigerian gene, that we have mediocre governance, we have a disconnect between good policy decisions and then the implementation of those policies?
No, there is nothing genetic about it at all. After all, if you take Nigerians to other parts of the world, they do very well in all spheres of human endeavor. There are Nigerian politicians abroad. They do well. There are some Nigerians have been elected to hold posts in other countries, which we know of, and they do well there. So what is happening here is not genetic. It's just a habit. It's just a habit. We just like doing things in a we decide to have a habit that is, we're choosing mediocrity as our
principle.
As our principle of doing things. That's all. There's nothing genetic at all. In fact, I think Africans, the black race, is particularly well endowed. Mentally, we are equal to the whites, and physically, we are more gifted in that we have white twitch muscles. I mean, all the best test of human fitness is 100 meters. The black race has dominated that race, and we are not inferior to the whites, to the West in mentally, but physically we are even superior physically in that we are always winning the world. The black race is always winning the 100 meters. So I think we have an edge. But despite the fact that we have an edge over all other races, would abandon that advantage and decide to settle for mediocrity.
You've spoken on a number of issues in the country over the years. You have taken on so many topics, so many contentious topics. And in one interview on BBC some years back, about 5 or 6 years ago, you were quoted as saying that when somebody asked you a question about how to deal with corruption, on the continent, and you said something like, I will quote now, there was a time, 1960 to 1980, when there was a negligible corruption in Nigeria. At that time, there was security of life and property, there was rule of law, and there was job security in government services. My salary as a young doctor in a Nigerian teaching hospital in 1981 was more than that of my equivalent colleague in New York. There were no incentives to corruption at all. But from the mid-1980s, the rule of law vanished, and the private sector was deliberately annihilated by the military in power. So money became an issue after that time. Do you still think corruption in Nigeria is that simplistic?
Well, I wouldn't know what you mean by being simplistic, but we know that we are where we are because essentially corruption in everything we do. Look at the educational system. How can you account for the fact that 48% of people, only 48% of people that sit for senior secondary pass in this country? How can you account for the fact that the federal government colleges, in which I had privilege to attend, like King's College, now those schools, majority of the students that pass through those schools fail? How do you account for the fact that the federal government even said, look, we can't manage these places effectively. Let the private sector take over. Let the old boys of these schools take over. The old boys of King College, we organized, we tried to move this, and lo and behold, some powerful forces went in, and the government changed, and the federal government colleges are back to their rot. What else can be responsible for that? What else?
Now, without wanting to sound too pessimistic, Dr. Ogah, so what do you expect Nigerians to now do? Now that we are back to the wall, things are not moving forward, there doesn't seem to be any light at the end of the tunnel. So what should Nigerians do?
Well, we should put a light at the end of the tunnel. my principle is this. If nothing is going on well at all, while we are waiting for that moment when we will start moving, right now we are not moving. And once you are not moving, you are going backwards because every other person is moving. While we are waiting for that time to have good governance or something, every individual, you and me, has something that is within your power. There must be something that is within your power in whatever profession you are, something good that is within your power. Why don't you do it? While we are waiting, perhaps, if each and every one of us can do something good within our power, it might help to generate good governance.
Okay, now, as a medical practitioner, how do you feel? Well, a medical practitioner is almost like a Nigerian elite because, those days when we were growing up, your parents always wanted to be either a doctor, an engineer, a lawyer, and all that. So
that's correct.
So, and then being a member of the Nigerian elite, how do you feel that our country parades right now in terms of status reports on healthcare, some of the worst results that you can ever think of, in terms of infant mortality, childbearing mortality, cholera, malaria. People are just dying as if there are no medical practitioners in Nigeria anymore.
I feel very bad about it, and I think it's a tragedy. We have Nigerians are dying in the midst of plenty. Nigerians are dying even when they don't need to. Even right now, even if the number of doctors in the country, even though I know that the number of doctors in this country are not sufficient, the ones there now are not fully utilized. And they are not fully utilized because of the corruption we talked about, because of lack of basic infrastructure, basic tools, no water, no light. So that a lot of the doctors who are working both in private and in government cannot do their best because materials to work are not there. Now, healthcare is not funded, and it can be better funded in a creative manner. It can be funded outside the well-known, unimaginative allocation to health, like a percentage of the GDP. That's the only method we'll be using. We allocated 5% last year. Let's make it 5.7 this year. And that manner, that method of allocating money to health is too monovalent, just unidirectional. There are other creative ways you can increase funding of healthcare delivery system.
For example?
For example, a universal national health insurance.
But you have something like that right now?
No, it's not universal. It's people who are in employment, like federal government and state. You don't have, the people in that insurance now probably no more than 4 or 5 million.
But even at that, some money is being generated through that scheme, right?
Yes, but you see, insurance deals with a game of numbers. The sick rate in Nigeria is about 30%. It doesn't need to be that high if they had enough water to drink. Most Nigerians don't have enough water to drink, so they are dehydrated most of the time. So the sick rate is very high because most Nigerians are dehydrated.
Can you run that again by me? You mean because people don't drink sufficient water, that is why we have high incidences of ill health?
It's a contributory factor. Because if you are adequately hydrated, your immunity goes up. You are better able to resist disease if you are well hydrated.
Amazing.
What is it that you do well if you are dehydrated? Can you run a race if you are dehydrated? Can you work as a farmer if you are dehydrated? Can you be a sawyer or a truck pusher if you are dehydrated? Can you read very well if you are dehydrated? We just took sips of water. Can you even talk if you are dehydrated? So most Nigerians are dehydrated.
Because there's no clean,
because there is no potable water. I mean, there is no potable water in every city, adequate potable in every city of Nigeria, including maybe Lagos and Abuja. Not to talk of rural areas. Now, so you have a high sick rate. You have health insurance, catering for just about 3 to 4 million people. The remaining 165 million people don't have a form of health insurance.
So you now advocate that
There should be, if Nigeria wants to fund healthcare system at all, there must be compulsory, universal, 100% health insurance for every citizen of this country.
okay.
This was started by Germany, by Bismarck in about 1885. They are still pursuing it.
In Germany.
Yes. Now, and when you say universal, it also has to be contributory. If it's left to government alone, there'll be a lot of corruption
Leakages.
and leakages. Let's say, for instance, you have 170 million Nigerians. Let every Nigeria pay 100 naira. 100 naira a month. 100 naira a month is more than the current allocation. The current allocation to health, when I worked it out, is about, like in some states, it's about 70 naira a month. Current allocation, federal allocation, is about 120 naira a month per person in this country. If you tell every Nigerian 100 naira a month, that will automatically double
What's available.
what is available.
But the question, the back end of that issue will be that the Nigerian you're asking to drop 100 naira every month, what assurances are you giving to him that his 100 naira will fetch him something back when he's ill? That really will be a question of credibility now.
Yes, if it is anything that is private run, if someone in a village setting, I'm in a village now, if someone in a village person pays 100 naira every month, and everybody in the village, and they know that they pay 100 naira, and they are supposed to get certain healthcare facilities, you cannot go without providing it. You can't go to a private hospital and you pay money, and the private hospital says he will not treat you. He will not treat you. They will have to. Just like you can't go to a barber's shop and pay 250 naira and the barber will refuse to cut your hair. Because it's a direct relationship. So if you have universal health insurance and it's privately managed, and you tell every Nigerian to pay 100 naira every month, you will automatically double, just by that very act, double the healthcare funding. Because right now, most of the allocation to health in the country is used to pay salaries.
Well, that is a big issue. We will continue with that. You're still on to Close Flow, and we have Dr. Ogah in there. We're going to open up the lines for you to call so we can discuss with him. We still have a lot more to share with you. So don't go away. We'll just take a break shortly, and then we'll come back to him so that we can then take on another issue. Stay with us. Welcome back. You're still on to Close Flow, and we still have Dr. Ogah in the house. He rested his last comment here on the question of how it is sad that the National Health Insurance Scheme is not doing what we can probably get out of it. And it's moved back to the village to start practicing in the village. My next question borders on the fact that how do you now cope? You're moving away from the city, you're going to the village. With this kind of structure that we have on ground, what kind of practice do you have in the village?
Well, what I do in the village is exactly what I was doing in Lagos. Of course, before I went to my motivation to the village is as I just said earlier on, most of the things in the country are not working. And all we are doing is pointing accusing fingers to other people, to government, and everything. And most of the doctors in the country, about 80%, are in the cities. Lagos has about 4,000 doctors. And you go to rural areas in my local government in Edo State, I mean, there's no private hospital. There's a general hospital where the doctor comes to work only, few hours in a week or a day and all that. So I saw that place was not served at all. And I looked, this is my 35th year post-graduation as a doctor, and I just said, okay, I've been in Lagos for more than 20 years, and there is a place where there is no doctor at all. And at this stage in life, I should be able to give something back. And following Socratic principles that says the eye sees without looking for any reward, the ears hears without looking for any reward, why shouldn't I give what I have, irrespective of what another person may be doing or not doing? This is something within my power. Why shouldn't I do it? And that's how I went to the village, and I've enjoyed it. I do exactly all the things I was doing in Lagos. I still do them in my village.
Well, you are a specialist.
Yes.
In virology.
In urology, yes.
Now, as a specialist in urology, how prevalent is that in the village? Setting? Okay, maybe you should first tell us, maybe educate us a bit. Urology would mean what, really?
Urology is a subspecialty in surgery that deals with the problems of the urinary tract in men and women, and the reproductive tract in men, especially those problems that are solved surgically.
Okay. So when a man has
he can't urinate,
for instance,
has an enlarged prostate, that is a problem for the urologist. If a man cannot sleep with a wife because he has impotence, erectile dysfunction, that is a problem for the urologist. If a man cannot impregnate his wife because he has low sperm count, or he has watery stem, or he cannot ejaculate, that is a problem for the urologist. If a person has kidney stones, that's a problem for the urologist. If a person has prostate cancer, kidney cancer, or bladder cancer, or passing blood in the urine, it's a problem. Or if a person is bedwetting as an adult, you have a lady who is 30, cannot get married because she bedwets, that's a problem for urologists. If children are bedwetting in the boarding house at the age of 16, and people are laughing, that's the problem for urologists.
But not all these cases require surgical treatment.
Not all the cases require surgical treatment. Some of them you can treat with drugs. But the urologists, especially that deal with urinary problems in men, in males and females, and reproductive problems in males.
Now, you are also a member of an association talking about men's health. Is it because of this specialty that you joined the association?
Well, it's not only because of this specialty. It's looking at health globally. Okay. The World Health Organization for years has seen, looking at statistics worldwide, that women live longer than men. In Africa, because of superstition, they believe that the women kill their husbands so that they can inherit the children, which is not true, it's just superstition. But the World Health Organization found that from all statistics available that men live shorter than women. Apart from the fact that men engage in dangerous activities, dangerous political moves, dangerous business moves, which leads to conflict and early demise. They found that the health behavior of men is a bit dangerous, more dangerous than the health behavior of women. In other words, what are we saying in simple matter? Women take care of their health more than men do. Okay. Men often have ego problem. Look, there's nothing wrong with me. I'm okay. But they are not okay. If a lady, be it a Nigerian lady or a white lady in America or in Europe, has a problem, goes to the doctor, complains, whatever tests they tell her to do, she will do them. Whatever medication they tell her to take, she take. Whatever precautions they tell her to take, they take. But men all over the world have ego problems. They always feel that, if you say you are sick, it means you are a weakling. Therefore, even when they are not well, they say, well, I'm okay. They don't go to hospital all over the world. Although worse here than in developed countries. Yeah. So the World Health Organization decided that they should look at men's health because there are health problems peculiar to men, which women don't have. I mean, prostate problems is a man's problem. Women don't have a prostate.
Yeah.
Men are more prone to some health problems which women don't have, many of them. And they decided to have a World Congress in Vienna in 2001 and invited one medical specialist per continent to come and give a rundown on the health of men in their continent. So they invited me. I was the person chosen to represent Africa to give a view of men's health of Africa. And so that there be a position taken by the World Health Organization on how to take care of men's health. At the end of that conference, in 2001, we formed the International Association for Men's Health that has a lot of programs to help people to deal with men's health issues.
That's quite commendable. Now, there is something I find appealing there, in the sense that because men usually are held in captivity, mental captivity, if you may excuse that that phrase, especially during matrimonial problems. A man cannot perform properly. He shifts the blame to his wife. He is in denial all through life and all that, and that seems to be a problem here in Africa. So, are you addressing such issues here?
Yes, we do. Because, for instance, if you will, something like infertility, male infertility. If a woman is not pregnant, the issue is that the society always believes that is the woman. And yet we know it's 50-50, more or less, 50-50. Problem is often shared. So the family of the man will just say, go and marry another wife. And this devil of whatever titles you give to people you think are evil in Nigeria nowadays. This your lady, this your wife is an evil woman. Go and marry another person. Goes to marry another woman, and yet the problems with it. So in this case, we tend to expose it to them very well that if you have infertility, for instance, the problem is shared, and in the cases where the man has the problem, you should agree to come for treatment. It's still a major problem in Nigeria. Most men don't want to come and do a sperm count. They say no. They will say, what are you talking about? I've impregnated that lady, I've impregnated that lady. I'll keep on telling them that you have impregnated a lady. It doesn't mean you are the one. Even if she was your girlfriend, a lady you may just have been a shareholder, and you may not have even been a majority shareholder. Some majority shareholder may have impregnated the woman you are claiming is yours, and it may be the lady is bringing the child to you because you are the richest, you are the richer. And the person responsible may be a richer fellow down the street, and the woman doesn't want to
expose that child to that kind of life.
Now that we are doing DNA testing, we know that about 1/3 of most of people doing DNA who claim that their father is not their father. So we tell the men that when you have a problem, come and do tests. Don't give excuses that you have children for other women.
Now, I'm sure we come to talk about how this campaign is going to be put on the street, because I think you have to engage the Nigerian men strongly, because a lot of men are still in denial and they will not probably want to yield, to what your position is. Now, but let's come to this issue of how unethical is it for a medical doctor to publish or to try to put in publication claims about his abilities or his specialist knowledge or his experience and all that? Is he unethical?
Well, what I would say, we are in a changing world, and truth is determined by what you know. There was a time in this world when they said the world was flat. And when Galileo said the world was round,
they nearly killed him.
They nearly killed him for it. So truth changes according to what you know. When you talk of ethics, it depends upon the laws extant in a particular country. in US, in advanced countries, when doctors have skills and they propagate them, as long as they are not lying, it's not considered as unethical because their level of advancement. Personally, I became a doctor because I watched a film of Michael DeBakey, one of the greatest surgeons in American history. He did a heart transplantation, the second heart transplantation in the world after the South African one, 1970. And I watched the video, 1970, when I was in Form 4 in secondary school. I came out of the hall for secondary school. I said, rather than going to be an engineer, which was what I was thinking, I was not going to be a surgeon. It was because of that video of Michael DeBakey that made me a surgeon today. That is the level of advancement in US as per 1970. But if you are in a perpetually developing country like Nigeria, they could feel it's extremely unethical if a doctor publishes an operation he has done, even if he has not lied. Where it is bad if you lie. But as I said, it depends upon the level of advancement of a country. It depends upon the laws extant in a country. If the laws extant in a country says to this level of development, this is unethical, then you have to abide by it.
Well, that's sad enough, but I don't want to call it controversial publication, really, but I'm just referring to what happened some years back. Just about 48 doctors were actually listed. What mechanism did you use to select those 48 doctors?
Well, when I made a publication of specialists in the private sector, 2005, I made clear in the publication what the purpose of the book was and what aim it was supposed to achieve. Because before that time, I was the president of all the private doctors in the country, and I was well known. And most doctors in the country, both in the private sector and the government, when they wanted a private specialist, they used to phone me and ask me, where can we get a private pediatrician? Where can we get a reliable private orthopedic surgeon? And I kept on answering phones. And I felt that if one had a publication and list as many as possible, then this will be available. So all these people always disturbing me that they wanted to know, they can't waste time again teaching us. They want to know where a private doctor specialist was in Ikeja or in Ibadan or in Osogbo. Should have that publication.
I think we have a caller online. Am I correct? Do you have a caller online? Yes. Do we have a caller online? Okay, maybe lost it.
Yes. So, there were no special criteria that you have to be a qualified specialist and a consultant level. There are two grades of specialists. If you are a doctor, you can be in middle grade. You do a diploma.
I just wanted to.
Hello.
They say.
Hello.
No. There's an echo.
Hello. Good morning.
Hello.
Good morning.
Hello.
Are you still there with us?
No. There's an echo.
Turn down the volume of your set. Okay. All right. So let's go on then. So you decided to now.
Yes. So what we did was to write to about 1,000
practitioners,
1,300 lists of consultant level specialists across the country, and told them what I wanted to do, and told them to populate an enclosed form. Fortunately, because of the level of development, only about 300 even replied at all. And out of that 30%, only about 45 submitted the required documents.
I see.
So even if you are something and you reply and you don't submit the document, there's no way I can verify. Then there's no way it can be put there. And whatever I had, I published.
That seems to be.
It doesn't mean
it's like your time came. The idea came before its time. Because right now, everybody's name or whatever, it's actually maybe on the website somewhere or something. So probably the idea came before his time.
Exactly.
But was the issue amicably resolved anyway?
Well, some people thought it was. Some people, though, thought it was.
It's self-perpetrating.
I was trying to make myself popular, and it was in the kind of advertisement, which I said it wasn't, because I was already well known. At the time, the Nigerian Medical Association was in crisis. For almost a period of about 6-7 years, I was the only doctor dealing with the federal government, because the medical association was broken into pieces, and it was only the private sector was there. So even when most of the time the government needed input from the doctors, I was the one giving it, so I was well known. There's some people felt otherwise, but somehow
that is part of history now. Okay, all right, you're still with us on Close Flow, and we still have Dr. Ogah in the house. Don't forget that. Please stay with us. We'll take a break now. Don't go anywhere. Oh, and we'll thank you for staying with us, and we do believe you are enjoying this exciting conversation with Dr. Ogah, who was a former president of the Medical Association. Now, you spent about 7 years in the northern part of Nigeria when you were doing your residency.
Yes.
What was it like, practicing medicine in the northern part of the country?
Oh, it was lovely. I did my NYSC in Borno State. I know Borno State more than any other state in the country. And it was a lovely place to live in. But 1979, yes. Maiduguri was an extremely lovely place to live in 1979. Started my NYSC 79, finished 1980. It was lovely. I was happy with the people. I was in charge of 2 big local government areas. I was living in Maiduguri. I go and teach student nurses, go and demonstrate to medical students. I go and teach the locals in the local governments where I was serving after my days. Teach them. State. Yes, in Borno State. Teaching them how to write ABCD 1, 2, 3 in the 2 local governments, Konduga and Kaga local government. It was lovely. When we finished, the governor was so happy. He wanted me to leave and he wanted me to stay. I said, no, I'm going to do residency. He even gave me a plot of land in GRA to build. I said, well, I'm not talking about house now, money. I just want to go and do residency. So I'm off. That's how I left. And a lot of the workers I was working with, nurses and men and women, they still phone me up to today, despite the fact that I have not been to Borno State since 1980.
So how do you feel about this current spate of
So I'm devastated to hear that there's so much violence in Borno State. One of the loveliest places with a lot of fertile lands that have not been cultivated for about 200 years, you have them in Borno State. When rain falls within 2 weeks, you have luxuriant fruits and crops growing. And yet, that is the place that is being devastated now by all kinds of war and killings and all that. It's a tragedy.
So, in your own experience, because you have dealt with a lot of people in your field as a medical practitioner and also in managing situations, in your experience, what would you hold down? How would you explain this? What do you think went wrong? Did you notice at any point in time while you were there? Can you put your finger or anything that is indicative that this is going to happen?
No. No, there was nothing. They were so lovely and nice. I can't imagine this happening there. I'm baffled.
Would you think this is the work of strangers, probably filtering into the local community and turning the populace around?
I can't say, because even for strangers to come to a place, they have to have local support. I can't pinpoint what really went wrong and when it did. I can't.
Now, it's medical practitioners in Borno State are no longer safe. That really is the depth of it. So, what's your comment on that?
My comment on that is that the government should work very hard to bring peace to the place.
I think we have a caller online. Yes, can we have your name, please, and where you're calling from?
My name is Honorable Femi Badejo from Victoria Island.
You're calling from Victoria Island. Okay, Dr. Ogah is there. Please ask your question or make a comment, sir.
Okay. My question, my advice, I'm not asking a question. I also contribute. My advice is high time we hold all the heads of each community responsible for any violence that comes out within that aspect. Because they should be able to put in some machinery that will be giving them information before all those things take place. If they are not abiding, abiding crime and this thing, all these things will take place at their absence. They must be aware of it before it takes place and call in the security agent before that thing takes place. So with that time, we hold them responsible. All the so-called traditional rulers, the head of each community, the so-called ballet and they should be held responsible for anything. By doing this, you will see there won't be any more violence in all these areas you are mentioning. But whereby we now leave them as if they are untouchable. They are the cause. If they relate with their people, in the conducive environment, there must be an information before anything takes place. That's my contribution.
Thank you, Honorable Badejo. Well, Honorable Badejo here is saying that, just like you said, that there's the local, element that is probably encouraged, even if there are going to be infiltrators, really, that there must have been some local support at some point. And he's saying that the community leaders...
That is a basic security advice, observation all over the world. That no thieves will not go and steal a bank if there's no informant. Nobody can come and evade a city if those people don't have informants in the city. I mean, it's a well-known fact, security all over the world. So, at what point it started is what I can't fathom.
Now, okay, let's dwell too much on that. So you are a happily married man, I'm sure.
Yes, I'm married.
With children.
I'm married with 4 children.
How many of your kids will be practicing medicine with you?
I can't say now. They are still... I can't say now.
But do you think any of them would like to step into your shoes?
Maybe.
I have a couple of friends who are medical practitioners who actually have grown-up kids, and those children are not into medicine because they don't think medicine pays in Nigeria.
Well, that is a fact. If your decision to study medicine is so late that it's going to pay, then only very few people will go into medicine in Nigeria. If the decision to study medicine is to look for something paying, very few people will go into medicine. So, for that fact, I wouldn't be surprised many doctors' children don't go into medicine. But if the decision is that the person likes it, it's a job he would like to do, and the person has a humanitarian mindset, he doesn't mind working very hard and taking very little home, then
so it becomes a passion for him.
Exactly.
Okay, now that brings me to the issue that I found that is missing, as it were, in medical practice in Nigeria. We used to, those days when I was growing up, we had what we call family doctors and all that. I don't know how many households in Nigeria today will have family doctors now. Do you have any idea of that?
Well, some few.
I think we have another caller online. Yes, please. Maybe have your identity and where you're calling from, please. Hello, are you still with us? Have we lost you? Okay, when it comes back.
Yes, some few families do. Just some few at least have personal physicians.
But it's not widespread anymore.
It's not widespread, partly because of lack of health knowledge. There's inadequate health education in Nigeria. There's poor organization of the healthcare system. In many countries where you have personal physicians, the government also has some input. There are areas, in some countries, let's say Victoria Island, they say this street, all the people here, you register with this family physician, and the government will pay. But in other countries, you have families that choose a personal physician because they are family physician. He has all the records of the family. If they need to be referred, they'll be referred to another specialist. And if any information needs to be, you want to get any information about them, then you phone the family physician and he will tell you. Yes.
That is another issue that I want us to look at again.
Am I through now?
Okay, all right, you're on. Hello, good morning.
Good morning, how are you?
Very well, sir. May we have your name and where you're calling from, sir?
My name is Tony.
Tony.
I'm from Bariga.
Okay, Bariga, please quickly ask Dr. Ogah. We don't have too much time.
Please, I want to ask the doctor if prostate can be cured without surgery.
if prostate can be cured without surgery?
Well, you can treat prostate problems can be managed without surgery. It depends upon the kind of problem in the prostate. When you say prostate, do you mean enlarged prostate or inflamed prostate or prostate with cancer? Which of them? It depends.
So that means you probably need to get a better medical clarification before you can answer that question.
There are some prostate problems that can be cured without surgery, but there are some that definitely need surgery, some form of surgery.
Does that answer your question? All right, thank you very much for calling. Please, we would like to remind you that you can also continue this healthy conversation with us on YouTube. If you go to www.nta2 YouTube/NTA2 Lagos dash close flow, then you can continue this healthy conversation. Just leave your comments, leave your questions, and I'm sure Dr. Ogah will pick it up later. Now, I wanted to ask you again, sir. Now, you said records, backup records, for the medical history and all that. In Nigeria, that would be a funny one to ask. Do we have records?
Well, all doctors practicing in Nigeria all have records of their patients they've seen.
In what form, sir?
Well, in customs. Some have it electronically. Some have electronic medical record. Some have them in hard. Only in hard, yes.
Hello, sir.
Hello. Yeah, good morning. Oh, we lost him. Now, from your experience, you have had about 35 years in the industry. So how do you keep your records?
Right. All the patients I see, I have records of them.
Electronically? In electronic form or in
hard copy?
In hard copy.
Yes. Like I have had patients I saw in Lagos 1991. They traveled from Lagos to my village, and they were surprised. The patients I saw in 1991, I said, "Can you remember?" They say, "I don't have my card number." "Can you remember the year?" He said, 1991 in Lagos. I just went to my records and pulled out the patient's case note. In fact, he wanted the report of his medical history for a long time. I pulled it out. He was surprised. So all doctors mandatorily is a responsibility. Once you are running a health facility, you must keep records, and records must never be destroyed.
Okay, now that leads us to another issue. The question of modern health management. In most advanced countries, the management of the facility is separated from the medical attention that the doctor should pay to clients. So why is it in Nigeria that you are the medical doctor, you are also the managing director, you are also the admin manager, you are also the accountant, you are also the auditor?
The main reason is because of the financial outlay. If you are going to have a health manager, an accountant, and all that, that means money. Okay? You are going to have a electrician. That needs money. In fact, when I was going to start up in a clinic initially, my friends told me, I know specialists. I'm not supposed to run my own health facility. I'm just supposed to concentrate on my expertise. And when it's needed as a urologist, I go and consult, operate, and go away. But that kind of center that is going to provide that needs a lot of money. If you are going to take a loan in America, you take a loan to pay 6%.
But here,
if you go to take a loan in Japan, you may have zero interest or interest less than 1%. So for you to have that kind of system, you need a lot of funding. And in a country where essentially everybody is a doctor, people set up drills, people go and buy syringes without doctor's prescription, people go and buy gloves without doctor's prescription, people go and buy drips and set up drills in people's house. Everybody is a doctor in Nigeria. You can go outside and buy ampicillin without a doctor's prescription. Therefore, the volume of medical care does not go to doctors alone, who are always supposed to be the custodian responsible for clinical care. Therefore, the income that goes to the people who are trained to provide the service is shared amongst people who are not even in the field at all. Therefore, doctors don't generate enough income to employ people to do non-medical work for them so that they can concentrate
On their main job.
on their main job.
Dr. Ogah, it's been great having you here, and it's been a very exciting, time with you. Spiced with all sorts of wisdom. What sports do you?
Oh, I play golf.
Oh, okay.
I play golf. In fact,
I thought you were going to say football.
No, I don't play football. When I was in secondary school, I was in athletics. As I said, I was in the athletic team in King's College. I was the best in my last year of King's College Secretary in 400 meters. And I was in the relay team. I was the captain of basketball in King's College and volleyball. So, but when I became older as a doctor, I became a golfer. And I wrote the first golf book in Nigeria, yes, which is still on now.
Thank you very much, sir. Yes, it's been nice talking to you, and I hope that we can, ask you to come in and, sit with us again so we can have more issues to discuss. But like I said to everybody, watching, please follow this conversation. Very healthy conversation, very illuminating. Follow it on YouTube. Just go in there and see a lot more that Dr. Ogah spoke about. So thank you again very much, sir. It's a pleasure.
Thank you very
having
much.
You here, sir.
Thank you.
Well, on behalf of everybody here, the entire crew, we want to thank you for staying with us. We hope to see you again same time next week. And don't forget that the Friday edition of the program comes up on Friday, same time, 11 a.m.